Welcome, everyone. It looks like we have about 16 people logged in so far. Everyone's coming in to the waiting room and joining us on the webinar. We'll get started here shortly. We'll give people a minute or two to settle in. All right, so it looks like we have about 20 people logged in. It's stabilized at that number, so we could get started.
If we're ready to go. So welcome to our third virtual town hall of the year. Today we'll be giving you another update on COVID-related matters. And this morning I'm joined by Lisa de Soto, CAO, and Robin Dinage, Manager of Communications. I'm going to be frank with you. Nothing has been easy for the past 9 months. COVID has been relentless and both physically and mentally exhausting. As a younger friend noted, COVID just sucks. From the moment the impacts of the pandemic began to hit us, we've been asked to be cautious, isolated, and adapt on a constant basis. Many of the things that we took for granted before, like stopping by the grocery store for a liter of milk, have become feats of heroism, if we bother at all. And because of COVID, we've all been asked to give up on so many things, and that sucks. We've been giving up time with our families, our friends, our colleagues, even with the people we didn't know we wanted to spend time with, until we had to give that up as well. We're giving up last-minute plans, birthday parties, dinners, even handshakes. So while the COVID pandemic reminds us what we've had to give up, and in some cases, what we've lost, it also serves as a reminder of where we place our values. When the pandemic is over, we want our businesses to still have business. We want our grandparents at the holiday table. We want to be able to hug our children and our grandchildren. And we want them to be able to play with all of their friends. We want our restaurants to be fully open and staffed so that we can stop eating the sourdough that we've been baking for months. Our community has shown resiliency when adapting to everything that COVID has thrown at us. But we need to keep thinking about what we value and how we can ensure that those things and those experiences and those people are here for us after the pandemic is over. Self-isolation is draining. Facing this new normal is exhausting. There are days that I just want to run away, but there's nowhere to go. What may be more destructive overall is forgetting what we value as a community, because COVID has redirected our attention. The individual and collective decisions that we are making to keep ourselves and our community safe are difficult. Some feel that what is being asked of them is too much. Others feel that not enough is being done. When it comes to making decisions, I believe that we can balance our health, our economy, and our social and emotional needs. The balance, however, is a fine one. We have to continue to shift and adapt so that we can respond to the data and the science that supports our decision-making. We all have a role to play during this pandemic. Following the enhanced public health measures and respecting each other will help us keep COVID a little less destructive. I'm asking that everyone respect the mandatory measures now in place particularly those prohibiting indoor social gatherings and no more than 10 at outdoor gatherings. This is really important. And it's up to each and every one of us to step up and do the right thing. To date, the Town of Canmore has taken a number of actions to support our community. In August, we passed the mandatory mask bylaw, which compels residents and visitors to wear a mask or face covering in all public indoor settings. It's important to note that the new provincial mask regulations for indoor workspaces do not apply to Canmore under the new enhanced public safety measures, but that our municipal bylaw helps to compensate for that. We've distributed 10,000 masks to the community. There's still about 5,000 left, and residents can pick up a package of 5 between 8:30 a.m. and 4:30 p.m. at the Civic Center while supplies last. We have implemented COVID health and safety protocols for all of our public indoor spaces. We're very proud of the safe environment that we are providing in our municipal facilities. The local health inspector considers the health and safety protocols in our facilities to have significantly reduced the likelihood of COVID-19 transmission in our facilities. And I'll note that we do continue to implement our rapid response plan, providing public notifications when we are informed of someone having tested positive who has used one of our municipally operated facilities. We created and continue to improve our online booking system in our rec facilities, so that you can book and use our spaces with confidence. We have made changes so that you can conduct your business with the Town of Canmore over the phone, by email, or online. We've created a community supports card connecting you to services around the Bow Valley. Through the Economic Recovery Plan, we've been able to support our local business community in accessing professional services through the business-to-business voucher program and recover some of the expenses associated with COVID through the Bow Valley Restart Grant. And this is managed by the Chamber of Commerce. We have supported our local arts community through the Building Neighborhood Build Communities project. As well, we are now actively planning how best to enhance our outdoor facilities, such as the trails, rinks, and parks, so that people can stay active and healthy throughout the winter. Watch for messaging about these opportunities soon. Now, I'd like to open the conversation, and here's how it will work. We have received many questions in advance of this meeting, but you can type your questions into the Q&A box using the icon at the bottom of your screen. I'll try to answer as many questions as possible within the remainder of our 60-minute session, with support from our CAO, Lisa de Soto. Once we have covered a topic, we'll move on so that we can cover as much ground as possible. You can always visit our website for more information. And as a reminder, I know that you have concerns. While we welcome differences in opinion, we all need to treat each other with respect. Now, Ms. Dinaj, can you provide us with the first question, please?
Thank you, Mayor Borrowman. The first question was submitted in advance of the virtual town hall, and it asks, will the Town of Canmore declare a state of local emergency and enact much stronger measures to protect us?
So no, not at this time. Very little can be done under a state of local emergency that we can't do under normal circumstances. The state of local emergency that we declared when Cougar Creek flood hit was very important, as it allowed for immediate response to rapidly changing life and property threatening conditions. but the COVID situation is quite different in nature. And we're able to make decisions within a day or two under our normal circumstances, which is a reasonable time frame for the sort of situation that COVID presents. We are under enhanced status, which means there are no indoor social gatherings permitted in any setting, including workplaces. Outdoor social gatherings are limited to a max of 10 people. Wedding and funeral services are limited to a maximum of 10 people, and no receptions are permitted. There can be no festivals or events, and tightly controlled use of certain facilities at the town are in place, and no group sports are permitted at all. So if the situation should change dramatically in the future, we can re-examine the value of declaring a state of local emergency, but this time I really feel that it's not necessary. We're able to respond directly to changing situation with our normal procedures.
Thank you for that answer, Mayor Borrowman. The next question has come in from one of the folks who's attending the live virtual town hall. And this question is, do you know where transmission is occurring in town or the age distribution of people currently testing positive?
I wish I knew more about that. It's pretty difficult to get those sorts of details from Alberta Health Services. I hear anecdotally, as do others in the community, about certain transmission cases, but I'm not familiar with any data that we've seen that indicates they spread through age demographics or other criteria. I don't know if Ms. De Soto has more detail on that question.
Thank you, Mayor Borrowman. No, I don't have any more detail to provide other than to say that that has repeatedly been asked by municipalities across the province, and Alberta Health Services has indicated that for privacy reasons and the ability to sort of detect who's who in smaller communities, that kind of data is not being released.
Thank you. We have another question that's come in from someone joining us today. And the question is, we saw a group of roughly 30 to 40 out of town folks rally the other day against masks. The province has outlawed groups of 10 or more. To the best of my knowledge, no fines were issued to these protesters. I understand that Bylaw does not have the authority to enforce these laws. What can be done going forward?
The questioner is right. At present time, the municipal bylaw officers are not authorized by the province to do that sort of work. It's entirely within the realm of the RCMP to monitor gatherings such as that and to handle the gatherings as the RCMP feel is best suited. And certainly we've been hearing that fines have been issued in other areas, even after the fact. So it's important for people to understand that the Town of Canmore doesn't direct our local RCMP detachment. That's we're able to a certain extent, share with the RCMP some of our priorities on an annual sort of a basis, but the local detachment is directed directly from the regional K division.
Thank you for that answer. The next question is also coming in from a live participant. When can we expect COVID testing in Canmore?
We've had a number of conversations with Alberta Health Services and other representatives for several weeks now, including the local hospital, looking for an answer to that question. And I know that most residents have not been satisfied with the ongoing provincial answer that Cochrane is close enough for Canmore residents. Many people now will be aware that AHS has authorized a new testing center that will be opening in the town of Banff in a couple of days on Friday, if I recall. And our understanding is that when people call the number indicating that they feel they need to have a test taken, they will be directed to the Banff clinic. If people in Canmore are not able to travel, then they can contact the local PCN, the Provincial Care Network. I think that's the acronym. And PCN will help them with getting a test here locally. I understand that in conversations with AHS, and Ms. De Soto could jump in on this, it's been indicated that they consider Banff to be, well, Banff and Canmore to be one community essentially. And it's been noted that in the city, people can travel much farther to get to a testing site than Canmore residents would have to travel to get to Banff. I'm certain, just before the CAO jumps in, I'm certain that if the situation changes dramatically, there'll be a reconsideration of that on part of AHS. That's the detail that I'm aware of. Ms.
Yes, thank you, Mayor Borrowman. I don't have much to add. You covered most of it there. Just to clarify that it's the primary care network of the Bow Valley, and yes.
I made a stab at it.
And they act as a resource and can work with folks that aren't able to or don't have a vehicle and can't get to Banff once that Banff testing site is open. But you're very right. The Bow Valley is small in population as a population center, and so one testing facility in the Bow Valley is considered sufficient by AHS for a local testing facility.
And I believe people can get the access information for the primary care network through our website if they can't find it elsewhere.
Yes, and the website, sorry, I was going to read it out, but it's not currently on my page.
It's bowvalleypcn.ca.
Right.
bowvalleypcn.ca.
That's correct.
Great.
Thank you. So on to our next question that's come in from someone watching today. This is specific to Elevation Place. It says, at Elevation Place, your bylaw allows people to exercise without masks, but the evidence suggests that droplets and aerosols travel further the harder one is breathing or exhaling. Isn't it time to cancel that exemption to masking?
Ms. De Soto is more familiar with the discussions that have led to our control mechanisms at Elevation Place, and I'll ask her to speak to that. I did mention earlier that the public health authorities have been quite clear in stating that they feel the protective measures that we have put in place in our facilities are really strong. But specific to that question, Ms. De Soto?
Yes, so specific to that question, and I would just emphasize, as you have, Mayor Borrowman, that we are taking our guidance from public health professionals and health experts. At the Town of Canmore, we don't have health professionals on staff, so we do rely on Alberta Health Services, both at the provincial level, from the recommendations coming through Dr. Dina Hinshaw's office, as well as our local medical officer of health and our local AHS office, who we are in regular contact with. We have spaced out all of our equipment for our fitness spaces, and we require bookings to ensure that we can meet the appropriate spacing standards in our facility. So you have to pre-book your time to do fitness or swimming or climbing at Elevation Place. And we are following all the provincial guidelines for spacing so that exercise can be done safely.
You know, in thinking about this question and a previous question about getting data on transmission, it would certainly be helpful if we were provided that transmission data, because it might change how we go about considering things like our facilities. Anecdotally, again, I've not heard of any transmission of COVID that took place at one of our facilities other than the Eagles, but that was separate from actual transmission, I think, within the facility. But
Actually, Mayor Borrowman, if I could jump in there, I think we can speak a little bit stronger to that. We certainly have been made aware by AHS that a patron of our facilities has subsequently tested positive. But through the work we've been doing to connect and contact with patrons who were in the facilities at the same time, and through our contacts and discussions with AHS, we understand that there's been no known transmission through our facilities. And that includes the Eagles incident. There was an article in the newspaper that clarified that that spread happened on the team bus when they traveled to Drumheller.
Thank you for clarifying that. So on to the next question from a viewer today. And by the way, we actually have doubled the number of participants in the virtual town hall since we started. We're up to about 40 people.
The word's getting out there, huh?
It is. So the next question is, what, if anything, is being done to provide accommodations for young people or employees who are often living in group living situations to help them safely isolate?
I know I was provided with some information on this.
Jump in there, Mayor Borrowman?
Yeah, jump in there.
Yes. Well, thank you for that question. Our FCSS department, the Family and Community Support Services Department, has been working with the local hotels. And if somebody finds themselves in that situation where they've tested positive or have a roommate that has tested positive and need a space to self-isolate, they can contact our FCSS department through just calling the main Town of Canmore number and asking for FCSS. And we are working with local hotels to provide isolation rooms should that happen. And I believe our website, and Ms. Denage can assist there. I'm not sure if it's been updated yet, but we'll have that information on our website.
Yes, it will be there. Thank you.
And we also have some resources for how to isolate effectively and when you're sharing spaces, and those are on our website and available through FCSS as well.
Thank you. The next question is also from a viewer today, and she says, I operate a tourism business here in Canmore. I feel right now we are getting mixed messages from various sources. Is Canmore welcoming visitors, or are we back to telling people to visit later? Are we open for Christmas or closed?
Those are really good questions. So at this time, we'll be continuing to encourage all visitors to observe our local regulations, such as the Canmore mask bylaw, as well as all provincial restrictions, of course. And this, when I speak about that, I'm including not only those from outside of the Bow Valley region, but also visitors from Banff and Lake Louise, Exshaw, Deadman's Flats, Harvey Heights, Lac des Arcs, the Kananaskis region, and our neighbors, the Stoney Nakoda. And we're also urging Canmore residents to exercise caution when choosing to visit Calgary for their personal shopping needs and to access other services that they can't meet here. But having said that, I would encourage all Canmore residents to think twice about their shopping needs and support our local businesses as much as possible. Don't go to Calgary if you can get what you need here while supporting your friends and neighbors' businesses. This pandemic has been particularly difficult for many local businesses. So let's all show support for our own business community at this time. I hope that spoke to the meat of the question.
Thank you, Mayor Borrowman. And while we wait for another question to come in from our live audience, there is a question that was submitted in advance that is sort of along those lines. And that question is, can we put signs at the entrances to Canmore to discourage visitation?
We certainly did that earlier this summer, and I believe signs have remained in place at the main entries, reminding people passing by that we have restrictions and particularly mask regulation. There hadn't been discussion at this point in changing that messaging. It might be part of a future conversation, but at this time we're not taking that step as we did earlier this summer.
Thank you for that. Another question that was also submitted in advance asks, will the town impose its own lockdown if the province fails to impose one?
No. As a municipal government, we really don't have the same authority as the provincial government. And implementing a lockdown, as has been suggested by some, is within the provincial realm of authority. So throughout the pandemic, we have continued to rely on the advice of the Chief Medical Officer of Health, and will continue to do so. But we do continue to urge people to follow the current regulations and exercise their personal responsibility to observe the current restrictions and guidelines.
Thank you, Mayor Borrowman. Another question, probably a little along the same lines, is Canmore doing anything to coordinate its protocols with Banff and Lake Louise?
Yeah, for sure. We're in regular conversation with Town of Banff, myself with the Mayor of Banff and Ms. De Soto with the Banff CAO. I haven't had much communication with Lake Louise about these matters, but we're in close conversations, close communication with Town of Banff, and they have a good idea of what their concerns and considerations are and how they're addressing those. There are many similarities between our two communities, but there are also significant differences between Canmore and Banff. And the most obvious actually is the number of staff that are living in shared accommodation in Banff, which anecdotally is perhaps what's causing the much higher number of COVID cases in the town of Banff. So yes, we communicate regularly, and we will continue to coordinate our actions as seems most appropriate and beneficial for each of our individual municipalities.
Thank you. And for anyone who is listening live to the webinar, please feel free to use the Q&A box at the bottom of the screen, and we'd be happy to answer your questions. In the meantime, we do have a couple more asked by members of the public in advance. And the next question is, what is the plan to manage numbers on the pond or outdoor ice services this winter?
I'm going to pass that over to the CAO as well. That's something administration has been discussing just this last week, and I'm not certain I have the most up-to-date answer on that.
Thank you, Mayor Borrowman. And, we certainly hope to get flooding ice surfaces as soon as possible so that we can have those outdoor amenities available for residents of Canmore. The weather hasn't been cooperating this week, but we will do that as soon as we can. And we will be putting signage up on the pond, just like we have around our trails, asking people to keep their distance as well as observe the mandatory regulations regarding group size. So there won't be any permitted groups of larger than 10, albeit we know that when the pond gets busy, there's multiple groups out there, and we understand that within the regulations, that's fine to be skating around. And the data has shown that outdoor activity like skating on a pond is very low risk for any kind of COVID transmission. So we would also ask residents and visitors to Canmore, just like we were in the summer when trailhead parking lots were getting full, that if they arrive at the pond and the pond is chock-a-block full, that maybe they can choose another outdoor activity to do with their family and go tobogganing or walk on the trails and come back at a less busy time. We'll be, encouraging people to do that regularly. We are also looking at partnering with Three Sisters and putting a third or another outdoor ice rink. we have the 2 boarded ice rinks in town as well, and a smaller passive ice rink on Rundle Drive. So there are other locations other than the pond that don't often get as much use as the pond, and we'll be promoting those other locations as well.
Thank you for that. The next question relates to one we had earlier about enforcement. And we know that our bylaw services CPO2s aren't able to enforce public health orders, but who do people call if they want to report violations of regulations and restrictions?
If people are witnessing social gatherings, for instance, that exceed the provincial restrictions, then the best people to call are the RCMP, and they will respond and enforce the restrictions, I'm told. There's other kinds of infractions that are best reported directly to Alberta, the Alberta government, and there is, well, I can give you a number for public health, which is one access point, 833-415-9179. There's a website as well. I won't give the whole website because it's a long one. But when you're seeing what you believe to be a violation of regulations and restrictions, then either call public health or the RCMP. That will be your best route.
Thank you, Mayor Borrowman. And just to reiterate, that phone number and that web link is on our website at canmore.ca/COVID, and people can find that phone number and links to make those reports. All right, the next question is, what is the state of readiness of the Canmore Hospital, especially as it relates to COVID? How many ICU beds are there? How many are occupied? What are the town's contingency plans in case things worsen?
Really good question, and that's been part of the ongoing conversations that I've been having with the Canmore Hospital, and the CAO has as well. My understanding is there are no ICU facilities at the Canmore Hospital, or I believe in the Bow Valley at all. So my recollection from conversations I had with the Chief Emergency in the summer was that they would send any critical cases to the city for ICU, but that, to my knowledge, hasn't occurred, or at least it hadn't the last time I talked with the doctor. I did speak with Dr. Wickham just last week, and he was still saying that they feel very positive about the situation here. He didn't flag any concerns that he had with the current situation or the ability of our local hospitals to respond quickly to situations. I know that Ms. De Soto has had a recent conversation with both Dr. Wickham as well as Ms. Shelley, and perhaps, Lisa, you have some other details?
No, Mayor Borrowman, you've responded just as they've responded to me, that the Canmore Hospital is ready and prepared to manage COVID cases that might come in the door. They also are prepared to do testing of patients that show up with other symptoms, and so they haven't seen a massive influx or a change to their operations as a result of COVID. For the most part, I understand that those who have active cases in Canmore have been able to manage successfully at home and haven't required hospitalization. And you're correct, my understanding is the same around the ICU, that any patients that would need a higher level of care, such as ventilation, etc., would require transferring to the city, to Calgary area hospitals.
Thank you for that. We are getting close to the end of the list of submitted questions that were sent to us in advance. So of course, if anyone watching live has a question, just click on the Q&A box below to submit it. And in the meantime, the next question is about our other measures. And Mayor Borrowman, you mentioned at the beginning of today's town hall that you weren't considering enacting a state of local emergency at this time. But are there other measures that the town of Canmore is considering?
We've had a recent conversation, we being council and the CAO, about the current situation. And at this time, other than the possibility of enhancing our outdoor facilities for the winter months, specifically, there's not other measures that we're considering at this time. I'll reiterate some of the measures that we have taken already. At Elevation Place, for instance, with canceling or rescheduling of all in-person registered programming until 2020 or the end of 2020. Climbing, aquatics, and fitness areas are staying open but are reduced capacity to 25%. And patrons will still need to book their time slot online, and they'll have limited time and access to other parts of the facility. I know that the library is operating in a reduced capacity as well, and we'll have curbside pickups, hours for vulnerable populations, but they're not providing in-person programming or public seating. I understand the winter day camps will be allowed to proceed under the current provincial guidelines. And as many will know, at the Canmore Rec Center, we do have some deferred maintenance that needs to be done in the building, so the building will remain open, but with controlled access for public skating and the walking trail. What's it called?
The walking lane.
The walking lane. Thank you. And you know, I have a number of friends that use the walking lane regularly, and part of what we're trying to do here is balance physical health with mental health. And it's really important that people continue to have access to some of those facilities to keep their mental health strong as much as their physical health. And with our other facilities, there's limited availability of entries. So Public Works, the access to the building is by appointment only. Here at the Civic Center where I am today, while our exterior doors remain open, access to the reception area inside and all of the offices that are on the main floor are by appointment only. We do have a warming shelter, the day shelter, that will remain open here at the Civic Center. It's in the classroom space. And that's open under very controlled regulations. And this is in order to provide a warm place for people to get out of the cold if necessary. I understand that the museum will only be open on Saturday and Sundays at this time. But I want to reiterate that we're monitoring the effectiveness of our changes in our current practices regularly, and we continue to evaluate usage in our buildings. And we're quite prepared to adapt to changing circumstances, making sure that we're doing the best we can at this difficult time. And as I mentioned, there's different opinions in Canmore as to whether we're doing too much or not enough. We're trying to find a balance that keeps people healthy and is in response to the science-based information and recommendations that we continue to depend on from the provincial health authorities.
Thank you, Mayor Borrowman. And we just had one more live question come in, and this question asks, what is council and administration's greatest area of concern? And what's your key area of focus right now?
Well, that's a tough one. On a light note, my greatest area of concern is wondering when I'll see my grandchildren again because they live far away. But On a serious note, I would say that that's something we've talked about just recently in this conversation around the ability to have accurate data is one of my biggest concerns. Is in many ways we're groping around in the dark. We're responding to situations that we see that we can be familiar with because they're happening here. We're making judgmental decisions that's based on more ephemeral information. If the province, if AHS could share more detailed data with the town of Canmore and with all municipalities, I think we would be able to make much more or much better informed decisions, and that sort of information might change how we go about keeping our community safe. Ms. De Soto, I'm sure, has some other things that she'd like to see.
Well, I think the question was, for council and administration, and certainly for administration, the priority, the number one priority is the health and safety of our staff and users of our facilities, especially our recreation facilities. So we have done another number of hazard assessments and, make sure that we're following all of the protocols. We do a number of training sessions for our staff. This summer, for example, there was concern for the safety of our bylaw staff when they were doing some of their enforcement activities. And we couldn't have a single bylaw officer working alone. So we had to make sure they were paired up and working in pairs. And so I think priority number one is health and safety of our staff, and I'm proud of the work that we're doing there and of the safety of our facilities.
Thank you. And that actually segues nicely into the last question we have for the day. How is the mandatory mask bylaw being enforced?
Well, the bylaw was always intended to be educational in nature. We haven't had the bylaw resources, adequate resources to be out enforcing the bylaw on every street or within every building. And we've always asked that business owners do the best they can to encourage their customers and do what they can to make sure their customers are following the bylaw. My personal experience, on the occasions when I get out and about downtown particularly, it seems to me that the bylaw is being followed quite strongly. But at this point, we are not actually enforcing the bylaw in public buildings or private buildings.
Thank you, Mayor Borrowman. And that is it for our questions today.
Just since I'm still in front of you, there's a thought that's related to that question, that last question, which is we all have to be, we all have to recognize that there are people in our community that can't wear a mask for health reasons, physical or mental health reasons, and we shouldn't be accusing others without knowing their situation. So again, it comes down to taking personal responsibility. Look after yourself, follow the rules, you know what they are, and don't be laying blame or fault on others. That's not your job. So yeah, be kind.
Thank you for that. Do you have any closing words before we wrap up today? Oh, looks like there's just another question that has come in. Do you want to take those?
Yes.
Okay, we've got a couple of quick ones here, it looks like. Bowness has fire pits available for locals to socialize. Will we be doing that?
I've heard some discussion about that possibility, but there's complications in monitoring and resources needed. At this point, it's not an active plan, but there's certainly been some discussion about that possibility. Again, if Ms. De Soto has more detailed information, jump on in.
No more firm details that I can provide, only to let the inquirer know that we're aware of the Calgary program, and we're looking at how we can safely do that in a Canmore context, where, you know, monitoring, I believe the Calgary fire pits are unmonitored or monitored by the users, and just given our wildfire risk, we're a little nervous, so that would require more resources from us from a municipal perspective, and how we would manage any kind of evening use, etc. That would be after hours. So looking at all the logistics to be able to do that safely before we implement a program.
Thank you.
Good
And
idea, though. I gotta say, I think it's a good idea if we can figure out the logistics.
thank you. And the last thing that came in through the chat box was just a comment thanking everyone for doing their very best at creating and maintaining a safe environment for us all.
Thank you.
Thank you.
Mayor Borrowman, do you have any final words for us before we wrap things up today?
No, I think that brings us to the end of today's session. So I do want to thank everybody for joining us today. There were certainly some great questions. I hope we provided adequate answers. There were some questions that wasn't necessarily top of mind for me. So hopefully the questions were reasonable, or the answers were reasonable. And once again, I really appreciate how most people in Canmore are handling the situation and looking after themselves and maintaining the correct, following the regulations when in public, and everybody's trying hard to keep our community safe. And that's job number one. You can always find more information on our website at canmore.ca, or by contacting us at 403-678-1500, or by email at askus@canmore.ca. And I understand that we will post a recording of this meeting on the Town of Canmore Facebook and YouTube pages as well.
Yes, that's correct. It should be up later today or tomorrow.
So I believe that brings us to the end of this virtual town hall. I hope it's been of value to those that logged in, and to any that go online to watch it in the future. And know that we're always available. I answer every question that comes via email. Sometimes it takes a while, because to be honest, I'm getting a lot of emails. Yeah, there's a lot of emails, but I'm trying to answer specific questions as they come along. And we have a new opportunity that we've just started, an online engagement page called mycanmore.ca. And if you haven't checked that out, check it out. It's a great online tool for Canmore citizens to engage with the town and understand what's happening on various projects and ask questions. And one of the things we're trying out is something called Ask the Mayor, which is just what it sounds like. You write a question and the mayor will try to answer it. And in that way, everybody will be seeing the answer, the question and the answer, which, when you write me an email, you see the answer, but not necessarily anybody else sees it. So that's probably filled the last minute or two of the time allotted.
Thank you very much, Mayor Borrowman.